Hi, I'm Dr. Peters with Peters Wellness Chiropractic and Massage. This week's quick video is going to address the question, hey, I hear once you start going to a chiropractor, you have to go forever. And well, I would say that's simply not true. If someone doesn't want to do something, or if they do want to do something, they can go ahead and do that or not do that, but they need to be willing to deal with the consequences. Take, for example, someone who wants to lose weight. They go on a diet, they're exercising, they're doing all the great things to do it, they lose the weight, and then they find out, well, in order to keep it off, they're going to have to maintain at a certain level of doing something for their health. Take, for example, brushing your teeth. Brushing your teeth, flossing your teeth, using mouthwash, getting your teeth clean. I mean, once you start brushing your teeth, you kind of need to do it forever unless you don't plan to keep them, or at least keep them nice. You should get your teeth cleaned every 6 months, sometimes 3 months, depending on how the tartar builds up for you. But with proper hygiene habits at home, that in itself requires less work from an outside source. And the same is true with chiropractic. Now, in my office, I have people come in and I do a series of 100 neurological tests. I grade them on a scale. And then I look at, typically we get x-rays of everybody. We look at their x-rays. Some people we get MRIs, some people CT scans or MRA, whatever we might need. And then we look at their history, we look at their test results, we look at all of their different tests that we've got in our hands, and then we create a care plan. And a care plan is not going to be forever. A care plan may be 4 weeks, it could be 3 months, it could be 6 months, it could be 12 months. It depends on the person. And then once that care plan is over, hopefully the person is using their foam roller at home. And if you haven't watched those videos, please do. Hopefully they're doing their traction, if that was a requirement or a request of them to do at home to care for themselves. Hopefully they're eating better than they have in the past, and they're going to continue that mission of better health. So you got the emotional, chemical, and structural side of the subluxations. And the emotional side, people are stressed out. People are working 50, 60 hours a week, not making the money they used to, or they have more expenditures. Chemical-wise, we've got fast food restaurants all over the place. It's easy to drive by, but if you got a hectic lifestyle, sometimes it's easier just to stop in and give in to that easy way out. Structural-wise, auto accidents, slip and falls, martial artists coming in. We've got people who, weekend warriors doing things. So things like that come up and may be done with their care plan, but they have to go back on a short plan for a period of time. And in my office for wellness care, what we typically recommend is 2 times a month. Some people need more than that, and some people can get away with less than that. But you need to know what will work for you, and sometimes experimentation is a great way to figure that out. And a great mentor of mine talks about the only mistake is an experiment that's run too long. So you don't need to do something forever, but whether you choose to do something or not to do something, just realize there's rewards and consequences. And think of a relationship, think of your spouse or your children. Once you have them, you don't just forget about them, you give them a little extra attention. And the rewards are tenfold. All right, have a great week.